Uh, Hi, everyone. I want to thank you for the opportunity for me to present you some update about our MSAT test, OncoSeek. So we know cancer is a very important healthcare issue worldwide. It's just not for rich people, but also cancer can hit poor people very hardly. So it's a global issue. And we know it is a big burden for mankind. So every year, there are about 20 million people got cancer diagnosis, and about half of them will die of cancer. To control cancer, we have three ways. One is prevention, so we stay away from those things which can cause cancer, such as smoking. And now we also have vaccines, like HPV vaccine to prevent cancer. And the other way to control cancer is to treat it, basically operation, radiation therapy, or drugs. But we all know these two ways can only partially control cancer. So are there the other means to control cancer? So basically, early detection or screening is a very important way to control cancer. Basically, when those patients identified earlier, so the treatment option are much better, and outcome is also much better. So, but then the question is how to detect cancer or how to do the screening more effectively. So we know now in developed country, there are roughly three ways to screen three different cancer types. So lung, colon, cervical, breast, and prostate. But then can we be better? So can we have innovations to screen cancer or to screen many of cancer types just at once? So instead of one cancer type at a time. And for those places, basically, you don't have a good medical system. So the question is, can these screening be accessible remotely? And the other thing is this method easy to scale up? And also another very important question is the cost. Can we develop a test which is much less expensive than the existing ways, as I mentioned, like a mammogram, CT scans, or colonoscopy. So can we develop an assay which may cost $20? So these are the things in our mind. So then we look at how to do it. So we had a proof concept study in 2 million pregnant women. So in that particular study, we applied so-called protein tumor markers. All these markers actually are widely used. We use AFP for liver cancer monitoring. We use PSA for prostate cancer screening. So these markers are well studied and also widely used. So, and also they can detect different cancer types. So the idea is, can we put different markers together? So then just develop a single assay to cover different cancer types. So in that particular proof concept study, we tested 7 protein markers as I listed here. And these markers, again, are widely used. So that's just using one example. So these are the instruments made by Roche. They have different throughput. They are fully automated again. So they're very easy to scale up and also doesn't need too much requirements on the training for the medical professionals to run those instruments. But the problem is, and actually, so these markers are already used in East Asia, such as China and South Korea, for cancer early detection. But when you use multiple markers, you also add the false positives from each marker together. So this just to show you those 7 markers. Certainly, if we add them together, we have better sensitivity. And meanwhile, the specificity becomes not good at all for screening. In this case, the false positive rate is about 41%. So basically, one of the 2 individual in this screening, if we use these markers as this conventional way, so the false positives is huge, it's close to 50%. The question is how to deal with false positives. So in this case, still again using the 7 markers at once. But then we also introduced clinical information such as gender and age. And we are using AI. In this particular case, we are using machine learning, try to reduce the false positives, but still maintain a good sensitivity. So we published a paper 2 years ago. Basically, we had 3 cohorts. We use our own cohort as a training set. So then we have 2 independent cohorts. One in China, another one is from the United States, from Johns Hopkins. And then we have Roche platform, and also we have the Bio-Rad platform. In this case, we have 2 sample types, serum and plasma. We had a good result, so we published the paper. So in this presentation, I'm going to show you 4 additional cohorts for additional studies. So we had a small cohort from our proof of concept study, which is from China on the ELISA platform. We also had another prospective study, which is blinded from Brazil, from our collaborator. And we also had a cohort, which is we call the symptomatic. Basically, those individuals, they have cancer-related symptoms. They are looking for diagnosis and the treatment. And the last platform is from another general hospital in China. So all these 7 markers together, so now you can see the performance of this AI-driven blood-based protein test called OncoSeek. You can look at the sensitivity, specificity in each individual cohort. And this just to show you all the cohorts together. We are using a special way called area under the curve to look at the sensitivity and the specificity at the same time, and look at the performance of each cohort. So basically, if the test has no power, the area under curve is going to be around 0.0, basically on this 45-degree diagonal line. And if this test is perfect, and you will see specificity is going to be from 100% in this case, then go up all the way up, then horizontally go to the end on this right upper corner. Basically, that's the area under curve 1.00. And when the area under curve close to 1.0, that's a very good result. So again, so you can look at the AUC here, basically close to 0 across, in different cohorts. And in the end, for the older cohorts altogether is 0.83. And now you can look at what's going to be the sensitivity and the specificity if we, at the 92% specificity cutoff, so the sensitivity is 58%. So basically that tells us by using this method, we can identify close to 60% of patients in this large clinical study. And then this just to compare the conventional method. If we look at the markers individually compared to this AI-driven method, OncoSeek, you can see now we can reduce the false positive rate from 41% to 8%. That's indeed a very dramatic decrease of the false positive rate. And this just across different tumor types. So basically what's going to be the sensitivity for each one. And you see those aggressive tumors are more sensitive because they are aggressive, and also they release more tumor protein into the blood. And like breast cancer is less aggressive, so that's why the sensitivity is relatively low. There is another factor for sensitivity here. So basically, if you have a tumor type, you have multiple markers, you have good coverage, so then you get a better sensitivity. And if tumor type, you don't have a good coverage, from those markers, the sensitivity is relatively low. And this just look at across 4 different stage. Certainly, the early stage is easier to detect, right? So you see the stage 4, the sensitivity is 80%. But then we also have a quite good performance if you look at stage 1. Basically, stage 1 is the early stage, right? earliest clinical stage. The sensitivity is 43%. And if we look at all the early stage together, basically stage 2 and stage 3, so the sensitivity is 49%, so almost 50% in this case. So another very important thing for this type of tests, blood-based test, for multiple cancer types, you need to know where the cancer is, basically, the location of the cancer. So you need to have some kind of prediction to guide clinicians to do further diagnosis based on this OncoSeek result. So this is just using, again, another AI method looking at the tissue origin prediction for those positive samples. And now we are looking at the top 2 prediction, look at whether, the accuracy for the top 2 predictions. So in this case, so the accuracy is 71%. So I pretty much finished all the data. So now it's just kind of try to summarize. We have a very large clinical study, covers more than 15,000 cases. And in this study, we have 14 different tumor types and 7 different cohorts from 7 different centers, and also from 4 different countries, Brazil, China, and the United States. And in this study, we have 4 different platforms, Roche, Abbott, Bio-Rad, and also the classical ELISA platform. And also we covered 2 different sample types. This is all about to show you how robust is the assay, basically across different centers, across different countries, on different platforms, and also different sample types. And we think this is going to be the workflow, how we are going to use OncoSeek. As long as you have a nurse to draw the blood, this could be in a remote village, So you take 1 tube of blood. If you only do this test, actually you only need 1 ml. And you can ship the blood at room temperature, basically, ideally. So you can use just the existing, ways to deliver the sample, such as postal service in this case. And then again, so the platforms are widely available, fully automated. So then we can do the testing in a central lab in this case. So then we use cloud computing to apply AI to the results to deliver the clinical report to you. Again, so this is a very simplified workflow. Basically, can be remotely accessible in many places. And this just about to think of what's going to be the applications. So there are 3 applications. One, as I mentioned, this could be used as a screening. Although at the moment, the specificity is, or the false positives are still relatively high, 80%. And we just published a paper about using the OncoSeek as a primary screening, then use another high performance, high cost test called Seeking Care to rule out those false positives. Again, so there is a possibility to use this for screening, especially for those places there is no screening at all. And the other way to use the test is for early diagnosis. Still, again, diagnosis is still an issue in many places, especially in developing country. So patients usually get diagnosed late because they didn't have the opportunity to be diagnosed earlier. So they have symptoms, they may have tissue mass, but they couldn't get diagnosis quickly. So we believe this assay can help early diagnosis in those in the symptomatic patients. Again, so in the symptomatic patient study, the specificity is 91% and sensitivity is higher, actually, it's 73%. Again, so these markers are already used for annual health check, especially in South Asia, China and South Korea. And this particular AI method can be used to reduce false positives, as I mentioned. We can reduce the false positive rate 5-fold from 41% to 8%. So this is just a conclusion. So we developed a very simple blood test using artificial intelligence. And we believe the assay could be used for cancer early detection, especially in those places screening and diagnosis are still issue. And we showed quite high specificity for the test, 92%, and the sensitivity is also efficient across 14 different tumor types. So that's 58%. In terms of the tissue origin to predict where the cancer is, so the accuracy is 71%. We believe this test is particularly useful in low and middle income countries because the resources are limited, infrastructure is limited. And the next step for us is to do a large scale prospective study to further explore the clinical utility of this test. So thank you for your attention.